Welcome to the RD2BE podcast. Each week we sit down with a different registered dietitian nutritionist to showcase the diversity of opportunity in the dietetics profession. Our aim is to dismantle the notion that there is a traditional career path. I'm Carl Barnes, the registered dietitian behind the scenes of RD2BE.
And I am Jenna Warnock, the RD2BE host. Our RD guests share their stories, career paths, and advice to help students like us succeed in the profession.
Welcome back to another week of the RD2BE podcast. I'm your registered dietitian host, Carl Barnes. This is our weekly podcast where we sit down with a different registered dietitian nutritionist each week to showcase the diversity of opportunity in the profession. This week, we're actually showcasing a dietetic internship. So we're really excited to be sitting down with Robyn Osborn today. She's the dietetic internship director at the VA San Diego Dietetic Internship. Really excited to have you here and learn more about the VA program in San Diego. Thanks for being here.
Happy to be here.
And I'm Jenna, your RD2BE host. And so, Robyn, could you first kind of describe what led you to your position as being the director of VA San Diego's dietetic internship?
Sure. I've been in dietetics education, I should say, for a long time. I've been in dietetics for even longer. I was in public health for many years before going into dietetics education. So I went into dietetics education in 1999. My first position was at a small university in Indianapolis as the didactic program director and the coordinated program director. So I was just, working in dietetics ed. In 2011, I learned about that this position was opening up, and I had heard about the VA San Diego internship, the dietetic internship, for many years as being a really strong, reputable program. And so I applied for it and was lucky to be selected. So I've been here since February of 2012.
Awesome. So it's been even over 10 years since you've been in the position. And one follow-up question that I always do like to ask with this is, do you have any noticeable skills or anything that you transferred from your previous experiences into this role?
Well, I think mainly because I had been working in dietetics education, primarily, probably most of my skills for this particular position was having worked in a coordinated program, because coordinated programs are similar in that the supervised practice component is completed during that program. So I had quite a bit of experience in organizing rotations, collaborating with other partners, preceptors. And so that's probably the main thing, in addition to just having worked with students for many years doing curriculum development and program planning. So I think that's probably.
And I'm sure that definitely has helped you, and especially with how long you've had the position, you've only really grown from there, I'm sure. And so with the VA dietetic internships before 2024, a lot of them have been standalone. Some of them have dabbled in combined masters, but once we hit 2024, you're either going to need to do a combined masters or you're going to need to have a graduate degree going in. And so with your program specifically, how is that going to pan out for you with students?
So at the present time, we're not offering a combined master's program. So for now, we're still just going to continue as a standalone dietetic internship program. So, so you're right. In order to be sure that our graduates are eligible to take the exam in 2024, starting this spring, for this upcoming spring match, or the spring application cycle, we will be requiring the graduate degree in order to begin the program.
I gotcha. And do you have any recommended graduate degrees for applicants, or any fields of graduate degrees?
Well, that's an interesting question. Of course, the main requirement is that they will also have completed the didactic program. So they'll have to have their DPD program completed. But that's an interesting question, I guess. I think probably one of the things that I would look at is if they've completed their DPD prior to doing a graduate degree, how long ago was it completed? Because as you know, our program has an emphasis in medical nutrition therapy. So we want to make sure students are well positioned, and it hasn't been that long since they took MNT. So that might be one of the things that I would look at. But I think in dietetics, there are a lot of complementary degrees. So I'm not sure that one would necessarily stand out over the other.
Definitely, and kind of a little later, we'll definitely delve into the MNT concentration
Sure.
to actually describe it. And so speaking of that MSDI option or kind of graduate degrees entering the scope for RD2Bs and aspiring dietitians, many supervised practice programs, they're transitioning to future education models, graduate programs, and a lot of different flexible ways that students can become registered dietitians. And so given your program is still local in San Diego, how do you ensure accessibility for aspiring registered dietitians to complete your program, especially with costs of a graduate degree, cost of possibly moving and things like that?
Yes, well, that is true. I mean, I think the advantage of it being a local program is all of the supervised practices here. Most of the supervised practice is completed here at the hospital. We do have some affiliate rotations, but one of the advantages of the VA programs, most of them anyway, on ours included, is that we do provide a stipend. I think another very key part is that the VA programs do not require any kind of application fee or tuition. So it is true that it can be very expensive to complete all the training in dietetics. But that's one of our advantages, is that while students would have to move here, and I mean, I don't think I could speak about costs without acknowledging the fact that it's expensive to live in San Diego. But we do provide a stipend. Stipends are going to be changing for the coming year. Our Office of Academic Affiliations for the veterans hospitals, that's the office that provides all the stipends, just announced an increase in stipend. So our stipend for the coming year is going to be over $21,000 for our 10-month program. And that's a significant increase. That's about a 65% increase from what it has been for the last several years. Still not a lot of money to live on in San Diego. So one of the things that I discuss with our matched applicants is the possibility of sharing, getting an apartment and sharing with one of the other classmates. What I find a lot of times is that students have, I don't know sometimes how they find other students, but oftentimes we'll share apartments or share houses, rent a room from someone. So I think probably most of them have to live with someone, whether it's a spouse or a significant other, or one of our other classmates, or another student. There are a lot of students in our area. The VA hospital is situated on the campus of UC San Diego. So there's lots of student housing in our area and a lot of students. So I think it's very easy for them to network. Well, I don't know how easy it is, but there is a lot of networking that they do. So I don't know if that answers your question specifically.
Oh, no, definitely. And actually mentioning how much the stipend is increasing by, 65%, and kind of recommendations you also included for students if they're moving if they're coming from out of state or not local, kind of collaborating and things like that. And that kind of prompted me to ask a similar question of how much communication do the interns have with each other over the course of the program?
Oh, that's a really good question. So I will say, let me just make one comment, is one of the things, I send out lots of materials after the students match, and the match is in April. They don't start, our program starts in mid-August. So there's several months that I'm communicating with them, that they're onboarding into the VA. And I do provide a handout with a lot of information about the neighborhoods in San Diego in proximity to the hospital, links to different kinds of, apartment finders and various things. So I try to provide information to them. One of the first things I ask them is, can I share your contact information with your other fellow matched classmates? So I connect them It's probably within a couple of days of the match. And so I know they start contacting each other and they develop kind of a group chat. That's at least what I've seen the last few years. And I have Zoom calls with them over the summer to just in preparation. But yes, they get in contact right away. They're all on site together pretty much almost every day. I mean, when they're in their rotations, they're not in their rotations together. But they share an office, and we have classes. We have an office, so they each have their own assigned computer and desk space and everything. So it's a nice office space. We meet almost every week, if not every other week or so for a class day. So they're in contact a lot. They almost live together, for the 10 months that they're here, and they supported each other quite a bit.
Yeah, and I think that's great how you mentioned like they have their own little office space, and they're literally, like, from what it sounds like, they're really just coworkers, and
yes,
just
absolutely.
and just combined with also possibly living with them, I'm sure that they grow really great bonds throughout the duration of the program.
Yes, yeah, very tight.
And with, I don't know if you have this number at the top of your head, but do you by any chance know the average number of applicants you get each cycle, and then how many you accept?
So for the last few years, last 3 or 4 years, we've gotten about 80 to 85 applications. We admit 6. So, the process, it's kind of it's a screening process to narrow down to a final pool. But we admit 6 every year. That's what we're funded for through Office of Academic Affiliations with the VA, and that's what we're accredited for through Ascend. This year, there's a change in the DICAS application platform, so that's a little bit new. Although new applicants wouldn't know, they wouldn't necessarily know the difference. But then with the graduate program requirement, we're not sure. I think when I say we, all of the freestanding dietetic internship program directors probably feel the same. We're not really sure how many we're going to have. Now, interestingly, this morning I did take a look at the DICAS application, and it looks like there were 39 applications in progress right now for our program. So that's encouraging, because I've had some concern that the number of applications might drop off significantly. So I don't know where we're going to end up. It's just January, and there's still several weeks before the application closes. But I'm guessing maybe we'll end up this year around 50 or so. But anyway.
Yeah, it's good that kind of your worries were kind of subsided a bit with the graduate requirements, but you still having a good amount of applicants. And with what you mentioned with the screening process, are there any specific things that you pick out of applications that you kind of either set aside as okay, this is a good trait to kind of keep in mind for this applicant, or one trait that's like, okay, I'm definitely not going to consider them, kind of just like both sides of the coin?
Well, we try to do a holistic screening process as much as possible. We do have a minimum GPA, and actually I changed that this year. We've had a 3.2 minimum GPA, and I changed that to 3.0 this year, trying to expand it a little bit. So I mean, that's probably an initial screening point, but I review all applications regardless of what the GPA is. And I mean, we look at a variety of things. Work experience would be one. Doesn't have to be necessarily work experience in the field, but I think that's an advantage. I mean, we know that students are not going to have clinical experience, but having worked in a hospital or a long-term care facility, even in the food service department, volunteering in a hospital, I guess one of the things that is important is the student's ability to manage competing demands, because it's a very busy program, and they're scheduled full-time in rotations, but they also have other projects and obligations while they're in the program. So that's probably one of the things. So if they've been working, how are they managing, if it's a full-time course load or not. So we look at that sort of thing. Letters of recommendation are very important. So I always, when I'm asked or when I do my open houses, strongly encourage students to be very mindful of who they select or who they request letters from, so that it's somebody who actually knows them well enough to speak to their preparation and potential for success in whatever kind of program they're applying to. Because sometimes letters of recommendation are very kind of boilerplate, and it looks like they, the letter writer just looked at their resume. Well, I can do that. I want to know a little bit more. So that's important. Their personal statement is important. What can they tell me in their personal statement that I can't glean from the application itself? Why do they want to come? How have they prepared for the program? So, I mean, I think, so I don't know that there's one thing in particular that stands out. I mean, I try to look at, all things, that they include, and it can only be what they include. So is the application complete? Have they left kind of glaring spots, that they haven't filled in? So make sure the application's complete and it's consistent throughout. Don't assume that there's something on the resume so they don't have to put it in their application, or vice versa. So I don't know if that answers your question.
Oh yeah, it definitely did, regarding what you kind of look for. And I mean, it's kind of the holistic approach that you give. They have to also give an equally holistic approach to how they portray themselves. And then it's okay if this is like anecdotal or just things in general, but on the opposite side of, if there's any stark things that kind of jump out, you did mention with like having a bland letter of recommendation, or leaving spots or grammatical errors. But if there's like big red flags that you see that kind of automatically, nothing aggressive, but just kind of you see that and you're like, oh, that's not ideal.
Well, that's an interesting question. It can be, different things. Sometimes if in their personal, if what they're communicating is that, the thing that they're really hoping to get out of an internship is not something that we can provide, because we are a veterans hospital and we don't have, so I was going to say, we don't really have children. We do, because I have affiliate rotation. So they do have some rotations with children and adolescents, but we're primarily adults. So, if they're uncomfortable working with older people, because we do have older veterans also, or they, there's something that's just really clear that it would not be a good fit, that I'm concerned that if they came here, they would really not be happy. So something like that, I think, would probably be, and it's hard to even, I can't even really think of an example. I mean, sometimes people will say they're interested in working in pediatrics, and that's fine, because we've had graduates, leave here and go directly to children's hospitals working in pediatrics. So, that wouldn't necessarily be the case. But if there's just something, that stands out, I don't know. That's a difficult question to answer.
Yeah, but I think you mentioning if they clearly write, whether it's in their personal statement or their resume history, either if they don't feel like they're either prepared, or if they either have an interest in the rotations. Because one thing that I did want to talk about is the veteran population and what they primarily see with that medical nutrition therapy concentration. And so with that concentration and with the common population, as you said on your website, mainly being adult men and not a lot of pediatrics, but kind of a similar common population with the VA population. What type of interns have you seen enjoy the program the most, either, from what you've seen on the applications or from what you've heard from interns?
So what do they enjoy the most? Is that what you mean? So
it's mainly the like types of interns, like because like what you said, if someone's interested in pediatrics, they do get that in involvement, but because the VA population is primarily adult men, or like geriatrics, what interests an intern has would apply to your program?
Well, I think sometimes when they come in, they're not really sure what their area of interest is. They may be interested in a clinical position, so learning more about MNT, or they may be interested in a challenging program. I will say one thing. So yes, the majority of our patients are males, but I looked up some statistics, and about 11% of our population is female, and there are more and more women veterans and more younger veterans. We do have older veterans, but probably the majority more are middle-aged or younger. They see probably all of the same kinds of complex medical nutrition problems that they're going to see in any clinical setting. We're not a trauma center, but we are a Research One facility, and we're a teaching hospital. So they have exposure to not only, all of the usual suspects, all of the same kinds of nutrition problems that they're going to see anywhere. So they have a really broad exposure to all kinds of clinical problems and complex patients. The other thing I will say about our MNT emphasis is it's actually medical nutrition therapy in inpatient and outpatient settings. So our program is 41 weeks, and probably about 23 of those weeks is in our clinical rotations. And of those, it's divided pretty evenly between inpatient and outpatient. So they have a really strong training in outpatient medical nutrition therapy, and that's primary care outpatient, as well as diabetes, renal, oncology, liver. We have a liver clinic, spinal cord. So we have a lot of exposure to outpatient clinics, as well as from an inpatient standpoint, the standard kind of medicine or med surg unit. It's typically called, those are just your normal hospitalized patients for a variety of reasons. They critical care, spinal cord injury, as I mentioned. So they have exposure, again, to all of the same kinds of problems, if not more so. I think spinal cord injury might be a little bit more unique to the veteran population. So I think it's just students who really want to have an exposure to a lot of clinical training, but we also I have community rotations as well. So they do a public health rotation, they do a WIC rotation, they do school nutrition. So they're not going to see those populations here at the hospital, but I want to make sure that they have those experiences while they're here.
And it really sounds like, because like with what we talked about before, where you said that sometimes interns apply and they aren't really sure what avenue they want to go. It really sounds like you still give them a well-rounded experience regardless, because on paper it might be like, the veteran population seems like just this one homogenous, similar, like you don't see a lot of variety, but on the contrary, you definitely explained how regardless of this common population, you still get a lot of exposure to different types of MNT, different populations, and really, from what it sounds like, if you want to work in a hospital, or if you have any interest in working in a hospital, it sounds like you definitely check all the boxes of where they could possibly be, and even beyond that in the community rotations as well.
Exactly. Yeah, and they also do a 5-week food service management rotation as well. I don't want to leave that out. So they get quite a bit of experience if they're interested in more management administrative positions. And I have graduates go in all of those areas. Some of whom stay at our VA or go into other VAs or any place. They're not required to work at a VA hospital after they graduate from our program. But I have graduates go into administrative, food service management or just management positions, community positions, clinical positions, pediatrics, as I mentioned before. So they can pretty much go wherever they want. And I think that's partly due to the reputation that the VA programs have, that we train them well, and they're prepared to go anywhere they want to go.
Yeah, and I'm sure that that's probably one reason why a lot of your interns choose your program, but do you have any other common reasons that you've maybe heard from interns or that you've seen as to why they do choose your program?
Well, I think the stipend probably has a lot to do with it. And I can't blame them for that at all. I mean, that's one of the reasons we provide it. I mean, the VA, as I mentioned, the VA, or the Veterans Health Administration, and maybe I didn't state it this way, but the Veterans Health Administration is the largest trainer of health professions trainees. So not just in dietetics, but in all of the disciplines. And so another advantage of our program is the interns here have an opportunity to interact and collaborate with trainees in all of the various health disciplines, as well as medical residents and medical interns as well. But getting back to your question, so I think the stipend probably is a big one. I think some of them are interested in clinical training, so they know that they're going to get that here. I think being in San Diego might be part of the draw. I have students who have come from out of state, East Coast, that then end up staying in the San Diego area. And I think there are probably quite a few who live in the San Diego area and for whatever reason need to stay close to home. And so they apply to our program. And I'm sure there are other reasons, but I think those are probably some of the main ones that I hear anyway.
Yeah, and those all sound like perfectly understandable reasons as to why, whether it was because I mean, I've only heard good things about San Diego weather and just like how gorgeous it is. And then also, again, the VA. I think another thing too that I've heard, and like you did mention this, is you're not obligated to work for the VA, but it does open up the door for working in the VA.
Yes.
And so like not only the job opportunity, but also, the rigorous work and really just getting a really quality education. And like with what you mentioned, like the VA healthcare system being the biggest trainer for healthcare workers, which I think is really saying something to the education that they get in your program. And so
I was just going to say that that's education and training of health professionals is one of the missions of the VA. So I think that's one of the reasons that they dedicate funds and provide stipends to the interns, to the trainees, and one of the reasons we do it as well as we do. I was also going to say, as far as employment, again, as I mentioned, interns are not obligated at all to work for the VA, but certainly we would like to retain as many of our graduates as possible. But not just here. I looked it up, and I think there are over 150 veterans VA hospitals around the country. And let's see, I jotted down there. Over 150 hospitals and over 1,400 community-based outpatient VA clinics. So whether it's staying in San Diego or going back home, wherever that might be, there's a lot of opportunity. The VA, I don't think the VA is the largest employer of dietitians, but we're one of the largest employers of dietitians.
So especially with those numbers.
Yeah.
Yeah, and definitely you guys give a lot of support to your interns, both financially and with what you mentioned with like those weekly or bi-weekly check-ins with the interns. And so are there any other ways or common ways that you support your interns throughout the duration of the program?
Well, I guess to start, I organize the program in such a way that all of the rotation schedules built before they get here. Doesn't mean it doesn't get modified sometimes, if a preceptor is sick or something like that. But I try to keep it as organized as possible for them so that while they're here, what they have to focus on is learning and making progress in the program, so they don't have to second guess what it is they have to do or what's expected of them. The rotation schedule's planned. There are various projects that they complete, but those guidelines are well developed. But I monitor them very closely, and if there's an intern that needs to have some additional remedial support, then I'll step in and work with the preceptors if we need to schedule some additional rotations with them. I work very closely with the preceptors. We have very strong preceptors here that work very closely, and all of our clinical rotations are one-on-one, the intern and preceptor. The food service rotation, there are two that are scheduled together. So a couple of our rotations, I pair them up, but for the most part, they're one-to-one, and definitely in the clinical rotations. And so the preceptors work very closely with them to, how do they learn best? What do they want to get out of the rotation? Of course, we have all the competencies and things that they have to meet. But whatever support they need, we'll provide. So again, if it's some additional rotations, spending additional time with certain preceptors, when they do a 4-week staff relief toward the end, and they can select, kind of rank their top choices, so that if they want to go back to renal because they're interested in renal dietetics, they can do that. I mentioned the classes. We do, well, in terms of preparing them to graduate, I have classes on resume writing, so I make sure that they have a polished resume before they graduate. I do practice interviewing classes with them so that they're prepared for interviewing. We do RD study classes, so to prepare them as much as possible to study for the exam. I would never expect them to graduate and try to take the exam without studying, but I get them prepared to begin studying. Those are the things that come to mind.
And I mean, that is definitely a hefty list of ways that you support, just whether it's with the classes, studying, and also I do find it nice how, because I do feel like with a lot of internships, you have a cohort, of course, you have interns that you're with, but a lot of the times I hear that it's kind of, you feel like you're on your own, or you feel like you don't really have a lot of intern communication. But for you guys, it definitely sounds like you offer support, but you also open the floor to interns supporting each other any way that they need.
Yeah, they support one another. As I mentioned before, they share an office. We use Microsoft Teams here. So the preceptors communicate all day long to one another on Teams, but the interns also are on those chats. And so they can communicate with one another, with their preceptors, with me. Besides which, their office is just down the hall and around the corner from me. Yes, they're not alone. Maybe the only time they might be alone is the public health rotation right now and the WIC rotation. Some of that is still remote, just as we're still kind of dealing with the pandemic. When they have those rotations, I let them work from home so they can work remotely. They don't have to come into their office here if they're doing a remote public health rotation, for example. So there might be, a few weeks during the program where they might be working from home because they're working with their preceptor remotely. But aside from that, they have a lot of support from one another and, from us as well.
For sure. And I think you have given a really great overview of like the populations that they serve, the different departments that they work under, and also just kind of what aspects of dietetics they work for. And so for one little final question, what advice would you give students interested in applying to your program or any of the VA program?
Interested in applying or interested in preparing themselves for the program?
Across the board, whether it be they're just thinking about it or if they're actually actively applying right.
Well, if they're actively applying right now, they're toward the end of their program. So hopefully they've prepared themselves, up to this point. One of the things, as I mentioned before, is be careful who you select to write your letters, because you want to make sure it's somebody who knows you well and is going to write a good letter. I'm sometimes surprised when I get some letters and it's like, ooh, I'm not, that's probably not the best person to write their letter. Either they didn't know them or they didn't really have, you want somebody to write a glowing letter for you. So that's probably the main thing. And when you write your personal statement, again, make sure you're selling yourself and you're telling us something about you that we don't know from your application. And why are you a great applicant? Make sure you have it proofread so that make sure you have some you have other eyes on it besides yours. So I think for somebody who's applying right now, for students who are thinking about it and maybe they're a year or more away, think about what kind of work or volunteer experience that you want to have. I know that's probably talked a lot about in DPD programs. One of the things I look for is not so much how many places students have volunteered for, like a lot of short volunteer experiences, but is there some longevity to it to really gain some experience or show some kind of more dedication, whether it's something they're being paid to do, a paid experience or a volunteer experience. If they can get that in a healthcare situation, because we are in a hospital, that can help them, but it doesn't necessarily mean that they wouldn't get into the program. Again, I look at MNT, just do as well as you can in your program. I think that's probably one of the main things.
Yeah, and I think definitely ending on the note of longevity with experiences, then hopping from one to one, that's a really good way to solidify both commitment, dedication, and also really being able to sit and marinate in the skills that you're getting from that experience.
Right. Yeah, and I think it demonstrates that kind of ability, again, that dedication, but that managing, time management, I guess, which is so important. Not just our internship, really any internship, managing those competing demands And you know, I'm very aware of the fact that there are some students who may have other obligations. I was a single mother when I put myself through school, and so my time to do volunteer activity was limited. You know, I was having to try to work, and my son was in elementary school and I was in school full time. So I'm very much aware of other obligations that students have. And so, you know, if that's something that someone can talk about in their letter as well, you know, if they want to explain that maybe they don't have a lot of work experience because of other obligations that they have. So again, you know, I mentioned trying to do a holistic application review. That's an example. You know, I'm not just looking at them as a student, but as a person. What other things have they been doing?
Yeah, and I think it was beautiful that you mentioned how you were a single mother while being full-time in school, because I think a lot of our listeners could also relate to that, especially the second career ones. And we have had guests on before that were also single parents while going through school. And so I think that, one, that's admirable. Like, I could never imagine doing that, just first, let alone having kids or any of that, but also just like going through school through that process. And so I think that's also just a testament of, whenever it comes to becoming a registered dietitian, you can still do it regardless of the obstacles. And I think that that's a beautiful note to end on, for sure. And just thank you so much, Robyn, for taking time to talk about your program. And also that personal note. Yeah, just thank you so much.
You're welcome.